What is the best Medicare supplement? Hi, this is Kathy Bukowski. I'm the owner of the CB Health Insurance YouTube channel. In today's video, we're going to answer that question. If you're new to our channel and visiting for the first time, don't forget to subscribe. Hit that little bell so you get future notifications when we release future videos, which is about twice a month. Feel free to give us a thumbs up if you like the video and tell your family and friends. Now, on to today's video. What is the best Medicare supplement? Well, I think we need to start by defining the word best because if you ask 5 people, you will get 5 opinions. So, what does best mean? Best could mean it covers everything, right? And I have little or no out of pocket. Everything is covered and I pay nothing. So that's one definition. Another definition could be it costs very little. It's the lowest premium I can buy there, which most people will agree. Lowest price doesn't always mean best coverage, So if you're paying the least amount possible, they're usually giving something up for that. And I think that's just common sense. We know that to be true. The last thing is, I can see any doctor. I can go to any provider. I have complete freedom to go anywhere I want. So let's talk about that last one, because this is something that actually applies to all Medicare supplements. When you're on original Medicare is A and B that you get through the Social Security office, right? We've been paying Medicare taxes all of our working life. Medicare is the U.S. government's health care for people over age 65 and those people under 65 who qualify because of a disability. So we're paying taxes, we get to eligibility and we sign up. Part A is subsidized, Part B we pay a premium, but we get that through the government, right? And so if we're on original Medicare and we pair that with a supplement, our primary coverage is Medicare. Medicare is the primary coverage, and people say, is it a PPO? It's an HMO. It's neither. It's the U.S. government's health care for people over 65. So 97 or 98% of the doctors and providers in the country take Medicare, okay? In fact, if they don't, they have to disclose that to you. And you can go to the Medicare website and look it up. A doctor has to tell you if they don't take Medicare. So you can go anywhere in the country, including Mayo Clinic, if you're on original Medicare and you pair it with a supplement, any supplement at all, because Medicare is your original. So we'll just put the kibosh on that. But note that there are a couple of discounted Medicare supplements out there that try to give you a lower premium if you use a certain hospital list. I'm not talking about those policies. I'm talking about the policies where you can go anywhere. If you buy a standard Medicare supplement, doesn't matter what company you're with, you are going to be able to go to Mayo Clinic, to anywhere in the country, okay, that takes Medicare. Now, let's talk about the second thing, which is it covers everything, and I have very little out-of-pocket costs. Now, covers everything. The way Medicare works, Medicare is your primary, so a supplement is only going to pick up after Medicare pays. And so really, we have people call our office that are on a supplement and they say, does my supplement cover this? And the question is, does Medicare cover this? So assuming Medicare covers something, and it covers most things, the supplement is going to pick up. But what Medicare doesn't cover are deductibles and co-payments. So for example, if you're hospitalized in the year 2023, Medicare is going to pay everything except this deductible. The deductible right now is $1,600 per hospitalization. Okay, so that's a bunch. And this is one of the reasons we say don't have Medicare alone. The supplement's going to pick that up. Okay, so there's a series of deductibles and co-payments that Medicare doesn't pay. There's a deductible for inpatient, there's a deductible for outpatients, there's co-insurance, and oh, by the way, that's unlimited, and there's all these different supplement policies. Now, is there a supplement that covers everything? The answer is yes, but there's a problem. It is no longer available to people who are currently eligible or turning 65 starting in 2020 and beyond. Plan F is the plan that literally covered everything. It picked up every deductible, every co-insurance policy. Now, those plans that were sold, people can keep. And if you are eligible or were eligible before 2020, and let's say you're 75 now and retiring for the first time, you can still buy Plan F. But it's those individuals that are becoming eligible for Medicare starting in January 1st, 2020 and beyond that cannot buy Plan F. And people are saying, well, that's no fair. But you know what? I say no big deal. And here's why. There is a plan that is identical to Plan F minus one thing. The one thing is it doesn't cover Part B deductible. What is the Part B deductible? Well, Part B is your outpatient services. It's anything done in an outpatient. Part A is your hospital, Part B is your outpatient. So when you go to the doctor, when you have a test, when you do physical therapy, any of those things are outpatient. There's an annual deductible and it's set by Medicare every year. In 2022, it was $233. In 2023, it actually went down to $226. Now that's kind of rare. It usually goes up every year, okay? So that's the one thing that's not covered. And the plan that is identical is Plan G. Plan G is identical to Plan F. And you know what's interesting? I have a lot of clients, because I've been doing this for over 33 years, who I sold Plan F because it was the best plan. It covered everything. And people wanted that plan. At age 65, it was extremely affordable. The problem is it keeps going up. And at age 75, a lot of clients are calling me saying, this is a lot of money. And they are actually switching to Plan G. They can keep that Plan F if they so desire, but they're choosing to switch. Why would they switch? Well, yes, they have to pay the $226. They might be saving $400 a year in premium, okay? And so they're like, oh, that's worth it. Every little bit helps, especially in today's economy. Now, I do have some clients who have plenty of money, not worried about a couple of dollars savings, and they said, I want Plan F, I want to keep Plan F, I want to pay nothing when I go to the doctor, and I want to go anywhere I want in the country. That's fine, you can keep Plan F. But if you're new to Medicare after 2020, you're not going to be able to buy it. Again, not a big deal. There's one more thing that I want to talk about, the best plan that you need to know, because when you're on Medicare as your primary, it's the U.S. government's healthcare, right? And we know this. You can go to any doctor that accepts Medicare. The doctor is agreeing to the payments that they're going to, or the reimbursements they're going to receive from the government, just like they would if they were signing up for a PPO with an insurance company. If they're doing a contract with an insurance company, they have the ability to negotiate for higher pay. With the government, you don't have the ability to negotiate. So the doctors and the providers are getting from the government what the government says we're going to pay you, and that's it. And it actually might be, it's probably more than Medicaid, but it's probably less reimbursement than on a group health plan or an individual policy. So built into the law, they do have some rules about how the increases every year to the doctors, which, by the way, are not keeping pace with inflation. And the doctors, the other part of the law is the doctors have the right to charge an excess fee, 15% over and above the reimbursement. So some people say, oh, that's a problem. I could be balanced bill. Not. There are, if you have a certain policy, there are 2 policies out of all the Medicare supplements that cover excess fees at 100%. Guess which ones they are? Plan F, which, oh, by the way, you can't get anymore if you're new to Medicare after 2020, and Plan G. Remember I said Plan G is identical to Plan F minus one thing. It doesn't cover that Part B deductible. It covers everything else. So what is the best plan? Let's define best plan. It covers any doctor. Well, that's really any supplement, is going to be able to cover every doctor. It covers almost every charges. You just have a small deductible, and that is Plan G. So we hope you found this video helpful. Feel free to share it with family and friends. Give us a thumbs up. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.